COVID is still very much on our minds with Omicron in this day and age and this time of year. But what else are you hearing in terms of concerns relevant to workers' compensation now?
So we do a survey once a year, and it's been interesting to watch how different items have bubbled to the top. There's a couple things that I would share with you, Sean. One is this concept of the Great Reshuffle, and what that means is that workers on the move, whether they're resigning from their current job or going elsewhere, or picking up and moving to a new geographic location, but this idea, the headline of a great reshuffle. Why this is important to workers' compensation is that when we look back over history and look back, say after the Great Recession, you had a situation coming out of that where you had new workers. So new workers are perhaps not as in tune with worker safety practices from their employer. Unskilled workers, particularly those in the higher hazard job classification, inexperienced workers, same thing applies. And so those types of things, based upon history, would indicate that there's a greater chance of losses, greater chance of loss frequency that could perhaps bend this long-term secular decline that we've seen on loss frequency. There's a lot of headlines on inflation in general. And I've read things recently where it's the highest in 40 years.
Yes.
But when we look at the factors that are impacting medical inflation and the actual results, it's muted. It's a 2 to 2.5% range. So it's not following the same trends that we're seeing elsewhere for different reasons. If I look back over a long period of time, which in this line makes sense because it's a long tail, and I look at the last 20 years, the first 10 years of the century, there was a lot of medical inflation. So 2000 to 2010, coming out of the Great Recession. And then the last 10 years, it's been muted. So why is that? One of the things that we're seeing is that the carriers have benefited from fee schedules, medical fee schedules in states. And that factor didn't exist in the first 10 years versus the last 10 years. The other is nurse case management by carriers. So those things are really important, and they've had a significant impact, in our view, on medical inflation overall. So the medical inflation is something we'll continue to watch. It remains a wild card because it could turn things significantly, but it's something we're always watching, we're paying attention to, and we're hoping for continued muted medical inflation.